Do you think that in some cases where the person might look fit, goes to gym, in that case also they might have a problem which they should address?
Yes, definitely. Some patients, they look very fit, they regularly exercise, but they wouldn't have had their checkups done. So we don't know what is their level of the sugars, their cholesterols. Some people think their diet that they're doing is right, but for each individual, the diet will vary. So based on their genetic makeup, based on their lifestyle choices, their work stress, based on that, each individual's diet and lifestyle choices vary. So unless they come for a checkup, we will not be able to guide them. So the real problem is not the lack of care. It is the actual delay in the correct care required for the.
So ma'am, I would like to ask you, we are talking about screening, but what is the screening like? How to go about it and how exactly screening works in real life when a person comes in for a checkup?
So what happens is we will be doing basic blood tests. So these blood tests will show you how your blood counts are, how is your kidney function, liver function, your sugar levels, your cholesterols. As you said, many people think I'm slim, I'm fit, I exercise regularly, but unless you do your blood test, you wouldn't know the status. And in certain patients who have very high risk of heart disease, there are certain blood tests like genetic markers which show that you are at high risk of getting heart blockages in future. So unless you do these blood tests, you will not be aware. The cardiac screening includes your electrocardiogram, which shows the electrical activity of your heart. It shows your pulse rate, it shows any abnormal heart rhythms. The echocardiogram shows the pumping efficiency of your left heart and your right heart. It shows the structure and function of your valves. It can rule out if you have any holes in your heart. Some of these diseases will not be detected until they're 40 or 50. So in the early stages, if you are doing your ECG and echo, you can catch these diseases.
The next question that I'm always going to get is why this screening, because everyone is not going to, first of all, in India, being in this population as we were talking about, that people don't even care about the early stages at all. I want them to address with this that why this screening, and when we have talked about the screening and all how it works, but why and when they should start the screening.
It's very important that the screening has to be done so that we can catch the symptoms at the early stages itself. And second, we can guide the patients. As I said, many youngsters nowadays we are seeing presenting with heart attacks. Some of them have simple risk factors like just stress. Some patients have only smoking. They are not even aware that smoking can cause heart issues. So such cases can be we can prevent. That is the importance of preventive heart health. You can prevent heart diseases. Many people think that heart attacks will come suddenly, just comes heart blockages form in one day, but that is not true. You have blockages forming in the heart over many years. So correcting these risk factors in the early stages itself, guiding patients about their proper diet, proper lifestyle choices, avoiding stress, correcting the risk factors, simple diabetes control, all this can prevent heart issues in future.
So ma'am, what I would like to know is, we are talking about why, when and everything, but let's say if I am a patient, I would really like to know how the screening basically works in real life.
So when you come in, we are not directly sent to tests. So we will sit and discuss with you about your symptoms, about your work-life balance, about how is your stress levels in your life, how is your sleep pattern. See, many people nowadays after this, their screen time is very high. They're sleeping at night 1 a.m. They say I have good 8 hours of sleep or 9 hours of sleep, but they sleep at 2 a.m. or 3 a.m. See, this is all stressing your heart. They are not aware that their lifestyle is actually hurting their heart. So when you come in, we will be taking a detailed history. We will do a general examination. We will look at not only your cardiac status but all your other systems also, and doing your ECG and echocardiogram and treadmill test. If you are able to rule out there is no cardiac problem in your body at this stage of life, it is quite safe and gives you also good peace of mind. But in case we are able to detect, say, high cholesterols for you or high sugars, we are able to correct it and with medications at the young age, it means in future you will not be developing any heart attacks or stroke. Say someone has bad habits like smoking or alcohol, regular counseling can also prevent the formation of heart disease if they are able to stop these habits.
Ma'am, how do you like to classify preventive care? Is it like a part of our everyday life?
Yeah, so preventive care, it's not about fear, it is about creating awareness. Our aim is not to frighten you or to give you a lot of stress about health issues and to daily think about what to eat or what not to eat. It is just about creating awareness. So one simple master checkup today can protect many tomorrows.
Nice to hear that from you, doctor. That's all for the day. Thanks a lot.
Thank you.